Hello to VNH family. So this is Nandini in the occasion of Bra Talk, which is a self-awareness program for girls and women. We would like to have a session with our renowned gynecologist, Dr.Usha Reddy, who has experience of 40 years in gynecology and obstetrics. And like today, we're going to have a question and answer session with Ma'am, wherein a lot of people have kept asking us, can we get answers from an expert like her? So we have compiled all those questions, and now we're going to get started with those questions. Good morning, ma'am.
Good morning, Nandini, and good morning to the VNH family. I'm here doing a recorded session with our VNH team. I guess there are lots of questions, and we would love to do an Insta program where you will have the live questions and I can answer you as and when you ask me the questions. We'll probably do it at a different date. I apologize for that, and I'm very happy to answer the questions which Nandini has for me, which you have asked. Thank you, Nandini.
So actually, ma'am is being so kind. She has a lot of appointments, and she's given us her time today. We're just not able to do the live session, but ma'am, please do not apologize. We have pleasure connecting you to our audiences, and I'm straight away going to the questions right now that you guys have. So first thing is that a lot of young moms have asked us that their teen are going through a lot of physical changes in their body at a very young stage. So when they do that, how do they educate their children that it is normal and that changes happen, and how do they cope up with taking those children in a very comfortable zone throughout this? Because a lot of people find like, I am not like my friend. I see a growth in a faster pace, and what should they wear under their uniform? So these are the questions that we hear from a lot of young moms. So what would you suggest for those young moms?
I think teenage is a very difficult age because of the hormonal changes and the mood changes and the body changes that a child is going through. And so also for the parent, and more so for parents who have a fixed idea of teenage or in the society have certain restrictions. It does become very difficult to bring up a teenager in this age, and I think mothers have to update and be with the next generation, as we call it. I think the bodily changes are not the same for different children, and yes, there is a lot of peer pressure. They always are comparing themselves to their classmates, to their friends, whether it's their body or whether it's their looks or whether it's their education and even their marks and performance in class. So I think teenage is a very difficult phase. Now bodily, because we are here to talk about a brazier which helps women, I think mothers, one, should give the girl confidence. Whatever might be her shape, her size, and as she is growing, she could be big, she could be small. Either which way, she'll have questions and doubts. I think one is give the child confidence, and whatever she is normal. That is very important. And I'm sure the mother has gone through a lot in her teenage, and I don't think she should rub all that on the child. It's very, very, very important to give the child the confidence and make them feel whatever they are is normal.
Thank you so much, ma'am. And also this one question of what should I wear under uniform, because my child is not yet ready for the brazier. But then I as a mom feel like she needs to wear something inside to have that little confidence. How do I tell her what is it that I should do is one question that we get.
This is very important, especially for girls who are shy of their dress. So I think there are teenage bras and early bras which they can wear. And if they still feel shy about something growing out and then they feel people are glaring at them, that's when they feel upset. They can always wear a slip over the bra, so it doesn't show as much. Then it all depends on how the child takes it.
And there's one more question where during the growth phase, when the tissue is growing, the slip-on bras which are little pressing, is it even healthy? Does it encourage growth or does it affect or something like that? Because a lot of mothers try to wear these slip-ons, so the child feels little better because it's not showing out. But during the growth phase, it's very important for it to let it grow in its own phase. So what would you recommend for that instance?
I don't think slip-on bras stop the growth, but I think it depends on whether you're a thin girl or a chubby girl. Now, slip-on bras are ordered for a little bigger size children, but the very flat ones need that support. So I think it all depends on the comfort zone of the child, but it doesn't affect the growth or the shape of the breast.
Okay. Thank you so much. So the next question that we have is like, it's from a woman. So they are asking like, what if we wear a wrong size or ill-fit bra? Because a lot of us don't know. Now this whole awareness program is to educate them. This is your right size, and you need to wear right fit bra. But what happens if a woman wear for a long time a wrong size or a ill-fit bra?
It definitely causes abrasions on the shoulder and definitely some markings in the back. And they find if they're on the heavy side, they have a lot of bulges, and which are getting enhanced by these. And if they're very tight, then and if they have an elastic, they'll find that there'll be a fungal growth underneath the nylon elastic kind of fitting. So I think one has to definitely get a right size. I'm sure the staff in any shop, yours is a wonderful one, but there are other people and there are places where everything is marked at the back of the box as to how you measure your breast at the base and how you measure at the level of the dimples. And the difference in the size gives you the cup size, whether it's A, B, C, D, E. Now A and B usually are not very difficult to handle. The larger ones need a much better strap and a back support because they are heavier girls.
Yeah, so this awareness program is all about them coming to our store, or they can actually, as you said, can go to any store and measure themselves. It's very
Yes.
important to measure. Is the
Yes.
whole communication we want to leave it to the
Yes,
women out there.
yes.
So the next question we have is, this is about what kind of braziers to be avoided, because currently we see a lot of different types of braziers coming out there. From being a necessity, brazier have become a fashion also these days. So what kind of braziers to be avoided in general, or would you advise women to wear a push-up, minimizer or wired bra? So if someone wears a wired bra, what are its side effects?
I think clothes are basically fashion, and they've been keeping on changing over the centuries. So there were times when women used to tighten themselves into corset so that their waist looked small and their breasts were pushed up. And I think it's the attitude of the women as well, because if they want to impress the men or the women, because often we women, we dress for women more than men. Though I think the men want to take credit and think women dress up to show off to them. I think with us women, we know we dress up more for ourselves and maybe for our other women. But I think this fashion of wearing bra has changed, and from wearing just like the Shakuntalai kind of a bra, we have come to, yes, we have come to wired and underwired. I think everything, whether it's wired, underwired, soft, it all depends on your comfort. So nothing is bad or nothing is good. I think there are even breastfeeding bras which have wires. Now if you're comfortable with that, it's fine. But if you're not comfortable, don't get into it because of fashion. And I think what you were talking, like the push-up and the minimizer, all depends on whether the kind of dress you're wearing. I think if you're going out for a ball, you'd probably wear a push-up. If you're wearing a suit, you're going for a regular formal meeting, you would wear a bra which suits like a Pantone suit. So I think all the different bras are for the kind of dresses you wear and what occasion you're going for and what your personality is personally, because you really want to show off, not show off, whatever your physical beauty.
So it's this thin line, ma'am. Exactly what you said is right. These bras are meant for specific purpose, but when we adhere to that purpose, it's fine. But I see a lot of women wear push-up on an everyday basis. So that is where I would want you to recommend or advise whether it's fine, because they have their purpose, but because they find comfort, they use them on a very long run throughout the day. So is it okay?
I think the very sense of pressure in the wrong places may not be right. So I think don't wear it as a regular thing. But I suppose, if one is comfortable and that's what the work demands, then and I think we should just leave it at that. But I would just say comfort and what really gives her confidence, happiness.
Thank you. And we have the next question. So this is about, should women wear bra at night? So is a sleep bra recommended?
Not really. One doesn't have to wear a bra while you're at home or while you're relaxing or when you're sleeping. And I think people go to the extreme of saying you can even sleep naked, and that's good for health. So I think no, first thing. But if people are used to something and they feel insecure, then they can wear something like a slip.
Slip. Okay. So next is regarding pregnancy. We have questions where like how to deal with bust size changes pre-maternity and post-delivery.
Breast size changes are very, very common in pregnancy, and usually the breast size grows. And one has to make sure that you have the right fitting bra. And like I said, you go and measure yourself, and depends, because some people grow exponentially in pregnancy and lactation, and some don't. And even if they have very flat breasts, they still lactate. So it's not like the size of the breast matters with lactation. And this could be a totally different show another day, because lactation is something so essential and people have lots of myths about it. But I think lactating bra, if you're comfortable with that, is fine. But I think you changing sizes will demand you to change the size of the bra or the type of bra.
So in this case, we can tell them that it is important for them to measure
Yes.
once in a while during their pregnancy
Yes.
course and adapt to the changes of the bust to the brazier size that they are
Yes,
wearing, not to
yes.
stick with the same size they have.
Yes, there might be some women who won't change at all.
Yeah. So until they do that kind of a test, they'll not be able to know that.
Absolutely.
So the next thing again for a pregnancy, would you recommend a nursing mom to wear a bra throughout the day? The feeding bra.
I think yes, it is essential because it needs support. And if you do not give support, sometimes you have engorgement, and then you have other consequences because of the engorged breast, which can get infected. So I think a supportive bra, a nursing bra, should be worn always for a nursing, for the nursing.
Okay, so it is important
It
because
is.
a lot of women think that letting it free during that phase is good, but this is a very informative information where they understand that it is important to wear during that phase. Yeah. Now we have a very common hygiene question. Could you share your thoughts on lingerie hygiene?
Lingerie has to be clean. Now, my experience is even if you do not wash or dry clean your outer clothes, your inner clothes have to be changed on a daily basis. And preferably, they're hand washed and kept in a clean place, and you have enough to go through the week. Don't have too many, because you might have to, again, at 6 months, when the strap gets lax or the back band gets lax, you might have to change the band. So let it not be an expensive affair, but definitely if you need 5 bras for the week, it's fine. And these 5 should be hand washed and kept neat and clean, and they have to be changed every day.
Just that we also received a question like this with us saying that can I wear the same bra 2 days in a row? So this was a question. So it answers it that you want them to wash it every day. So
Yeah.
the answer to them is like not to repeat your braziers until and unless you have cleansed them and washed them, hand washed and all.
Yeah.
Just use one day, like just
Yeah.
one
And
bra
if-
a day.
And if you're living in a humid place like Chennai, you might need to change it even twice a day.
Twice a day. Thank you. And these questions are for senior citizens. Now they have this question where like once I reach around 50 and 55, I am not feeling very comfortable wearing a brazier. I find it uneasy to carry it, but then I have to go forward and carry on my left. What should I do for an alternative for a brazier or something? What options do I have is the question we have received.
I think you don't have to wear a bra. I think we're all in the age of saying we let the nipple go free. So at any age, bra is not a necessity. Bra is what you feel comfortable with and what makes you feel confident as a woman. And I think beyond a certain age, if you don't want to wear it, just don't wear it.
Yeah. I have another question where like what really happens to a youngster at 20? She decides to go braless and now a bigger bust size or a smaller bust size. What are the changes that happens to that physical body which decides to go braless from a very young age?
I don't think it decides a lot of things because one can be braless and we have seen that from centuries. So it's not that it's an essential part for your body forming. But I think larger breasts need support. So I think that's where, especially with the modern age when they're exercising, and you have to use special sports bras so that you have the right support. Otherwise, you will find them becoming very painful. And the smaller bras also need a well-fitting bra which holds the breast against the chest. Otherwise, the movement during a sports action would be in the form of an 8, and therefore it does cause a lot of pain. So, if, especially the modern children, when they're exercising, they need a bra. Now, otherwise, it's their choice.
Otherwise, it's their choice. So this sagging is one of a concern that generally we have even for those who wear brazier. So someone doesn't exercise but doesn't have a brazier in their routine. So does it encourage more of a sagging kind of a thing? Because there is a concept where bra helps you lift. You know, that support system is where we have created brazier for. So what happens when you don't have a brazier? Does it lead for more sagging? And it's my acceptance to go ahead with that.
As one who's examined many breasts, probably on a daily basis, I think sagging happens due to your elastin in the skin. And you will find a lot of people, as the breasts keep budding, they have stretch marks. Like sometimes you find men who exercise will have stretch marks where they've grown their muscles, maybe on the shoulder or back. So stretch and elasticity of the skin matters, even in the abdominal skin for the pregnancy. So I think the sagging part of it is partially that's how your body is built. And whether you had children, whether you're breastfed, whether you're not breastfed, really doesn't matter. Because I see some women who are quite young, even 28, 29, they've had a couple of children. They're not really breastfed, they have, but not much. Even them, I find that the breasts are sagging almost to the waist. And then they have to wear a bra just to lift it up so that when they wear it under clothes. But I think more than that, if they want a permanent good look, it has to be plastic surgery. But sagging of the breast is partly how the lady's skin is made and how she sags.
Thank you so much. So this is about breast cancer. So one of the question is like, how often should women have the breast examination done, and what is the right age or time when they start their first breast examination?
I think breast has to be examined if you think something's abnormal. And a lot of people find that their breasts are not of the same size. And let me tell you, it's a very, very common.
Yeah.
A lot of people think, oh, it's a very rare thing, or maybe it's just me, it's not the other women. No, it's a very common thing. Maybe 80% of women have asymmetrical breasts. There again, the bra comes into action, because if you choose a bra for the larger size breast, the cup size, then you will have to support the smaller breast with a pad. So because a larger breast should not feel squeezed.
Because larger breast is the one that we fit in, right? And the
Yes.
small can give in a support
Yes.
with a key
Yes.
or a pad.
Yeah.
Okay.
I think women should be conscious of the breast from very early in the age, but maybe from the age of 25, one would like to just feel their breast, preferably after a period, even when you're having a bath. You're soaping yourself or you're lying down. You can just run your flat of your hand and examine your breasts, and as often as you can. The monthly would be maybe bordering on paranoia, but it's good. Good to be watchful.
So is there any medical test kind of a thing you would recommend?
If
after
you
the surgery?
notice there is a lump, you go straight away to your doctor, and then they would probably do an ultrasound, a mammogram, and take you further, depending on whether you have a lump or you don't. Sometimes people have lumpy breasts, and there we just give them some vitamins and essential oil capsules, and then probably the tenderness or the lumpiness or the pain settles down. But often we have to examine the breast maybe after a particular age of say 40, 45, when they have a regular checkup with the gynecologist and they themselves are checking, and they can also have a mammogram. Different countries have different protocols, and some countries have started a mammogram every year after the age of 50. Some don't. Like the European countries may say once in 5 years you have a mammogram. But I think the best thing is to examine your own breast, preferably after period and after menopause also, on and off on a regular basis, and definitely report anything that you notice which is
Which is abnormal or not.
yes. And if you have a family history of breast cancer, all the more you will be the kind of person who is probably watching it. There are women who are actually going for breast removal because they have the genes, and we have a very popular or celebrity, Angelina Jolie, doing it because she had the DNA for breast cancer.
Okay, so even not noticing this breast
Yes,
cancer, she
but
chose
they
to-
have mastectomies and they have plastic surgeries to look normal for their confidence.
Thank you, ma'am. And the next question is, what type of bra would you suggest to a patient who just underwent breast surgery?
I think once you heal your wound, then you would again go for the right size. Because we as surgeons have done breast reduction surgeries, breast enhancement surgeries. So actually we ask the patient what size. Say suppose we are having a breast reduction. Somebody has a very huge breast, and I have seen women who's got huge gashes on their shoulders because they have such heavy breasts and the bra strap is carrying the weight. So we find that there is a big scarring and there is a big gash on the shoulder, and it's becoming old wound. So those people for whom we reduce, we ask what kind of size would you need, and they would say 34B or 36B or 34C. So accordingly, the plastic surgeon would reduce it. So also for enhancing the breast. So other breast surgeries like abscess or tumors, I think we have to, suppose we have to remove the breast, one side, then we would just ask her to fill up the cup with something soft. It would
Yeah,
be
the
cotton.
mastectomy braces that are asked can help them out to fill in loose. And then there is a myth that says that going braless reduces breast cancer. So I would like to hear your thoughts about that.
I don't think that either increases or decreases the risk. Like I wouldn't say wearing a bra reduces the risk. So also not wearing a bra is not going to increase the risk. So I think breast cancer is something that you probably inherit or develop. And the external factors of wearing a brazier or not wearing a brazier probably doesn't have a significant effect.
Yeah, because this myth is going around when people say go braless that it helps reduce the risk of cancer. So we wanted to hear from an expert.
But a lot of these things are in vogue, nothing. And whatever is in fashion goes. Fashion keeps changing. So people's ideas keep changing. But I think actually giving the wrong news to the public is what hurts. So I think whether we support bras or don't support bras, I think one should not scare the public.
So thank you so much for telling that. So next we have is have you had any experience with a patient where they develop skin allergies or irritation with certain lingerie fabric? Because we generally say go cotton and all those, but have you ever experienced someone using some specific fabric which is
I think more than the fabric, it's definitely the elastic hurts. And then again, the elastic doesn't hurt everybody. It usually hurts the girls who are larger. So as it is, they have so many folds, therefore there's no air circulation. And an elastic or nylon kind of base, which is basically used in all bras for the comfort zone and for the expansion, that hurts, and then they develop a fungal infection. Allergies as such are very rare.
very rare in terms of fabric? Thank you. And now we have a last question, which a person like you who is very busy on every day, I want you to share that thought. So how can women in this busy lifestyle take time to look after themselves? Tips from you for women to take time for their self-care.
I think these tips I should give to myself as well. So I would definitely say make a healthy diet, exercise, and definitely some sort of a recreation or a hobby. It could be gardening, it could be cooking, it could be music, it could be dance. Develop these habits. So I think one has to give yourself time to exercise and keep the body agile. It doesn't have to be every day in the week, it could be even 3 to 4 days a week. And then definitely hydrate yourself, eat healthy food, and then depending on the necessities, whether as you're growing older you may need more calcium, you may need more vitamin D, you may need hormone replacement therapy after menopause. So all these things I think you have to take care of, and definitely spend some time for yourself, however busy you are, and how much ever you work for your family. And if you're not going to be well, then you're not doing the family a benefit.
So true. So this is exactly what we wanted to hear from Ma'am, and I'm gonna thank Ma'am on behalf of VNH family and on behalf of all our customers who are listening to this. And Ma'am is also would like to do a Q&A session live with us later. We'll definitely keep you guys posted. And thank you so much, Ma'am, for giving your time.
Thank you,
Such a
Rasani, and thank you,
appreciate.
team.
Yeah. Thank you, guys.